Are you feeling anxious at 13 days past ovulation? You're not alone. The 2-week wait can feel like an emotional marathon. By now, anticipation builds. You might be ready for that home pregnancy test, hoping for answers. But what if you get a stark white test and feel no symptoms? This silent moment can crush expectations. A big fat negative test at 13 DPO often brings confusion and disappointment. Why are there no signs of pregnancy when you hoped for them? Let's dive into the science behind this. At 13 DPO, fertilization and implantation should have occurred. But sometimes, it's not that straightforward. Implantation generally happens 6 to 12 DPO, starting HCG production. HCG levels double every 48 to 72 hours. That's why many consider this a reliable testing day. However, a negative test at 13 DPO does not guarantee you're not pregnant. There are legitimate reasons for this. First, late implantation can happen, delaying HCG production. If implantation occurs on DPO 12, HCG levels may not be high enough yet. Then there's the slower rising HCG. Each person's reaction varies, leading to possible delays in detection. Don't overlook test sensitivity and urine dilution too. A diluted sample might miss low HCG levels. That's why experts recommend waiting until your missed period, around 14 DPO, for accurate results. Another concern at this stage is the lack of symptoms. Society often expects clear signs, like nausea or fatigue. In reality, many pregnancies have minimal early symptoms. The absence of symptoms does not imply you aren't pregnant. Many experiences revolve around progesterone. This hormone rises after ovulation, mimicking classic pregnancy symptoms. So, if you do feel symptoms, they could point to PMS. Conversely, no symptoms do not rule out pregnancy. The key takeaway? Lack of symptoms is not a reliable indication of pregnancy. Focus on your unique experience instead of generalized expectations. Your test result remains the most objective evidence. So, what steps can you take if faced with a 13 DPO no symptoms BFN? Start by waiting and retesting. If your period doesn't arrive soon, wait another 48-72 hours. This timing lets HCG levels rise. Always use your first morning urine for testing, as it's the most concentrated sample. You may also switch tests for clarity, try digital tests for clear results. Lastly, monitor for your period. If your period is late and tests continue negative, consider consulting your healthcare provider. They can order sensitive blood tests to clarify your situation. What if a positive result appears later after a BFN? If you do get a positive test, contact your doctor right away. Schedule your first prenatal appointment and start prenatal vitamins as recommended. Now, let's tackle some FAQs. Can you still be pregnant at 13 DPO with no symptoms and a BFN? Yes. It's less common, but late implantation or slow HCG rises can cause false negatives. What's a false negative? A false negative means the test shows negative while you may still be pregnant. Many healthy pregnancies come with minimal symptomatology early on. When should you retest? Wait until day 14 DPO or a day or two after your expected period for the most accurate results. Feeling anxious as your period approaches? It's critical to acknowledge and manage your feelings. Engage in self-care activities that bring joy and reduce stress. Avoid getting caught in a web of online searches that fuel anxiety. Trust your journey, regardless of the outcome. In conclusion, a 13 DPO no symptoms BFN can feel devastating, but it isn't the end. Individual physiological variations mean there may still be hope. Remember that delays in symptoms are normal and don't rule out pregnancy. By understanding the science, setting expectations, and taking practical steps, you can reclaim your sense of control. Be patient and trust your body's unique timeline. Clarity is near, and your strength will guide you through this emotional stretch. If you like this video, please share, like, and subscribe to this channel.